We just came live. That was perfect timing.
Okay.
Give people a minute to tune in here to our 4 o'clock stream, produced by the First Tuesday Conservatives, presented by Alpha News. I'm your host, Kyle Hooten, as usual. Joining us today is Twila Brase. She is the president and co-founder of the Citizens Council for Health Freedom and the author of Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records. Ms. Brase, thank you so much for joining us today.
Yes, I'm glad. Thank you so much.
So we have a lot to discuss today between your usual work and your book and the coronavirus pandemic and your work with the council. I suppose to start off, what is the council and what sort of work do you do?
So Citizens Council for Health Freedom is a nonprofit. It's a national nonprofit, free market nonprofit located in the state of Minnesota, but we do work not only at the Minnesota legislature, but also in Congress. And we are really all about stopping socialism and protecting the patient-doctor right to work together for the benefit of the patient.
Absolutely. You know, it seems like most businesses, including hospitals, function better when the client and the service provider can engage in sort of free relations. That makes a lot of sense to me. Your book about the dangers of electronic privacy in the exam room. Tell us about that.
So I just happened to have a copy.
Wonderful.
Right next to me. As you can see, it's got all of these because it doesn't have an index, and the next iterations come out with an index. But really, the whole thing about Big Brother in the Exam Room is to tell people the story of how the takeover of the practices of medicine is happening through the electronic health record. As to really say that HIPAA does not protect privacy, no matter what you think. It doesn't. It was actually implemented to make sure that you don't have privacy, and that all the third parties who want access to your information to control your doctor can have that kind of data without your consent, unless there is a stronger state law like we have here in Minnesota, which for 6 years we have had to defend from big business, big government, and big data. And so it tells the story of how it all started. I got the history in there. I've got stories of how the data access works. I have an entire section on HIPAA with actual quotes so you can't misunderstand what HIPAA is once you have read my book. And there are other sections in there having to do with different ways of privacy that people aren't understanding. Like baby DNA that's being taken, or the genetic information that's being added to the electronic health record, or the people who want to use it for value-based care, which is about paying doctors for doing what the government or the third party wants them to do and calling that value. And rather than paying them for actual services or for time spent with you, or sometimes not paying them at all because the outsiders say, well, that didn't have any value.
Sort of a lot of shocking facts to cover, a lot to go over there. I want to circle back on some of that. You mentioned that big tech and big data and these other entities are trying to control healthcare via the electronic record system. It seems like a lot of people know about Obamacare and that sort of incursion into healthcare, but not very many people know about this other intrusive problem in the exam room. What sort of interest does big data have with your health records?
Oh, well, just as an example, United Healthcare is like the largest health insurance company in the world. And they have a data division called Optum Insights. And in, I believe it was 2017, Optum Insights, which the only thing they do is data, patient data, it's all they do, right? Their revenue from that was $8.1 billion. And so this is where United Health Group is getting a lot of their money. There are also people who the whole purpose is to buy and sell it. There are purveyors of data, medical data. It can be de-identified. However, de-identified is not what people think it is. And today you can even figure out from somebody's DNA without their name, a certain percent of people you can figure out who they are, which was a shocking thing that happened about 4 years ago. That a researcher figured it out for 10% of the population that he was looking at. He knew exactly who it was with just the DNA sample. So yeah, so okay, anyway, there you go.
You mentioned DNA, and it's a nice segue to another thing you said earlier, that there are entities that want to log people's DNA and submit that for research. Very concerning stuff. Could you expand on that?
I think that happens in a variety of ways. It's interesting. Michael Crichton wrote a book once, and at the very end of it, he had this little educational nugget.
Mhm.
And because he was writing about hospitals taking your blood for this test or that test or whatever, and taking more than they needed and using it for research and claiming it to be their own to do whatever they wanted with it. And people don't think about that when they're in the hospital. So that is one thing that is happening. But the other is just comes at the government level. So newborns at birth are put through newborn screening, which is taking some drops of blood out of their heel, putting it on a special filter paper, and then sending that paper to the state health department, where they do what's called newborn screening. But as we say, it's not newborn screening, it's government government genetic testing of newborns at birth within about the first 48 hours. And then a number of states have started to keep that DNA, like Michigan keeps it forever. They've got a data bank and they say, 100 years or forever. And that storage is not done with patient consent. Now, because of our organization discovering this in 2003, here in the state of Minnesota, there have been 5 lawsuits. The 5th one is happening right now in Michigan. And we won the one in Minnesota. There were 2 Texas lawsuits that were won. One in Indiana was not won. They just didn't have enough information, I think, to argue it correctly. And Indiana has 666 banker boxes filled with the DNA, 23 years of children born in Indiana. They're now making that DNA available to researchers without consent. You can opt out if you even know that you're in there, but most people don't know that they're in there. Right. So, and in Minnesota, the parents won, but then the health department did a very sneaky thing and changed the law without anybody figuring out what they were doing. And so now the collection of the newborn's DNA began again on August 1st, 2014. And parents can opt out if they know about it, but they mostly they don't know about it. And so we're working at the federal level to try to get a law that says you can't use the children's DNA without the parents' consent for federally funded research, which is most research.
Absolutely. For those of you who are just tuning in, we're on the line with Twila Brase, the president and co-founder of the Citizens Council for Health Freedom. She's telling us about a very concerning practice that occurs across America where newborns have their blood sampled and their DNA logged or screened, and those records are retained and sometimes accessed without patient consent. You mentioned how state governments aren't forthcoming with how this DNA data is collected and disclosed. Why do you think they are resisting transparency, and what are they doing specifically with these records?
I think different states probably have different reasons for not being forthright with parents. I mean, we tried to get the law here to even talk about the fact that it was genetic testing, not just newborn screening, right? It's genetic testing by the government. And they did not want to put the word genetic in there because I think they think that people are going to resist newborn screening by the government if the parents understand that their children are being genetically tested.
What is newborn screening? What does that term even mean? It seems kind of Orwellian.
So newborn screening is these little drops of blood that get put on this filter paper, sent to the health department, and then the children are screened for newborn conditions that are of a genetic nature. Okay. And they started with one test, PKU, and then they went up to sickle cell. And then in 2003, they expanded it to anything that the health department wants to test the child for, which is when we discovered it and said there should be consent for newborn screening and there should be consent for the storage of the DNA.
So the government is asserting their right, supposedly, to test everybody that is born in a state for genetic diseases. Why are they doing that? Is that the proper role of government, to be testing people for diseases without even informing them?
Well, we don't believe so, but because of how the state laws are written, oftentimes the doctors don't even order it. It's just something that every hospital does because in some states it's mandatory. In Nebraska, they will take your child away from you if you refuse. In Minnesota, we have conscientious objection. You can just choose not to have it done. Some states don't allow that, or they allow it. There's a bunch of states that allow it for religious reasons. But for the most part, parents oftentimes don't even know it's being done. And then if it is being done, they don't know why they shouldn't even, consider doing it. Now, the screening, lots of parents really like it because there are newborn conditions that are very dangerous and they can figure it out early. But we really believe that parents should be asked. And
Yeah.
we really believe that it should be done privately, not at a government lab where then the government lab keeps the DNA on file. Now, Texas, one of the lawsuits in Texas was because the parents figured out that the DNA was being bartered and sold. So Texas was selling the DNA to a company that was then giving them equipment for their laboratory in exchange for the children's DNA.
Interesting. Can this DNA be accessed for criminal proceedings? Like if you need to check a DNA sample against some sort of database to determine, guilt or innocence in a crime, has that been done yet, or is this kept scientific so far?
It's been speculated to do it because some would like to do it because they say, it's a DNA of almost every child born in the country. And so then they would have this for such purposes, but it has not happened yet because of course that would be very controversial. And as you know, you cannot take the DNA of an adult unless they have been charged with the crime. But here the government is keeping and storing the DNA of children who are innocent.
Absolutely. Yeah, if law enforcement wants to do a DNA swab of your cheek, they have to get a search warrant.
That's
but
right.
If the government wants to collect your DNA and then catalog it at birth, it happens without even informing your parents. That's fairly egregious. How long has this practice been occurring, and how many people do you think are logged in these DNA databases?
There are 4 million children who are born every year. And I should make it clear about the DNA databases.
Sure.
So there are data banks and they are cards and they have this blood on these 5 or 6 filter paper spots, maybe this big or so. And they take punches, little tiny punches or bigger punches out for different kind of research or different kind of tests. And then they're kept in there in these banks. We call them DNA warehousing. Now the DNA itself is not sequenced.
Okay.
But there are people who would like to sequence every child at birth, which would mean your entire DNA, your entire genome would be known by the government and in your medical record without your consent. There would be no genetic privacy and no choice. It would be taken away from you at birth. The federal government actually did a $25 million 5-year project to see what would happen if they sequenced children.
Wow. So it's definitely something they're interested in. Right now, just to reiterate, there's warehouses full of cards with every child's blood on it. And then they can sample that blood off the card to use it for research, but they want to sequence all of that DNA. That's totally egregious. I don't know how more people aren't aware of this. I'm very glad you're on the show talking about it. Your organization, of course, has been leading the charge to fight this practice. How successful have you been? And what do you think the future of this practice in America is?
Well, we certainly got I would say that we are it's because of us that the first 4 lawsuits happened. The 5th lawsuit is just because somebody was an attorney and they figured out that their child's blood had been stored and they got perturbed. And so that's one that's happening now in Michigan. But the other ones happened because our organization did press releases on them. We got parents together in Minnesota for the lawsuit that was successful here until the health department figured a way around it. Yeah. And then at the federal level, we got a law which was temporary that was a parent consent law for federally funded research. But it went away on essentially the last day of the Obama administration when they issued a rule the day before Trump's inauguration. And so, those who want the DNA of children, like the March of Dimes, for example, they are persistent in wanting to not give parents any control over their children's DNA. And every child grows up to be an adult who will not know that their DNA is on file with the government. Now, I should say that not every state keeps it long term. There are states that are not keeping it long term. And so the last time we counted, I think that was 17 states that were keeping it anywhere from 10 years to indefinitely.
Wow. You're not the first person to be on the show that mentioned some rule that the Obama administration sneakily made in its final days. That's been a trend lately, unfortunately, and we appreciate you pointing that out. To jump now from one health policy and security concern to a related concern, I want to talk a little bit about COVID-19. Of course, you informed us that it seems like people's rights are being violated every day with this, DNA sampling process. But we also have seen a lot of people claiming that their rights are being violated with coronavirus. What's going on in the research side of this, and what sort of areas should people be concerned about when it comes to the virus and their privacy?
Well, I would just say there are so many lies misrepresentations, partial facts,
Mhm.
and outright lies, like for instance about the masks. Now you might recall that the CDC initially said, don't wear masks, don't wear masks, they aren't even going to help you, right?
Yep.
And now the CDC is like, everybody should be wearing a mask. Well, now if they really believe what they're saying now, then they were putting all of us in danger in March. They were saying all of us could get the virus and they didn't care because they just wanted to reserve them for the healthcare workers. And so then they lied to us. But the fact of the matter is, the truth is what they said in the beginning. Masks do not stop viruses. Viruses are itsy bitsy tiny kind of things. And so rights are definitely being taken away with the mask all the time. And the fact that people are putting this barrier between them and the air that they breathe, and being willing to give up the right to breathe freely, speak freely, engage publicly. Just today I was in a restaurant which said, yeah, I know, you've got an exemption, but people got mad the last time you were in here, put it on social media, and we can't do it. And so as a business, we're saying you have to have a mask, right?
Wow.
Yeah. So, and so this is really discriminatory. And so it's put in, and then maybe you heard it in Ohio, the woman who got tasered
Yeah.
because they couldn't get her off of the field because they said she had to have a mask. And of course, the mask doesn't help at all.
Mhm.
And the World Health Organization says that we have a campaign called the Face Freedom Campaign. And we ask people on Face Freedom Fridays to put their smiling, unmasked faces on social media. And we have illustrations that have been on Alpha News and op-eds on Alpha News, trying to build the resistance against the mask, because for us, it's existential. If the government can put a barrier between you and the air that you breathe, they can force you to do anything in the name of public health. The next thing will probably be the vaccine. And partially, I think, because the mask doesn't work, and because the numbers of deaths are plummeting,
Mhm.
and because they're not talking about that, it's possible that they just want to convince everybody to take the vaccine and to move the entire nation toward government mandated vaccines for whatever, because the vaccine choice community is growing by leaps and bounds.
Mhm.
And these people just want a choice over which vaccines they can take or they will take, and the ones which they won't take, right? But this is an opportunity for all the big government officials who want us all doing whatever they say to do anytime, to use the mask, to keep it on so long that people are like, fine,
Mhm.
I'll get a vaccine just to get rid of the mask. And this is not good for our country. And that's why we think it's an existential threat to freedom, and have started the Face Freedom campaign. And we'll see, what more can be done about this, because it can't stand as a legitimate use of government power.
Mhm.
Um,
Absolutely.
so
Moving to the vaccines, you mentioned those. What's the research looking like there? I know that I've grown so weary of reading about vaccines and masks and all this stuff. Are you optimistic that the vaccine will even work? And how likely do you think it is that it will be mandated?
So if you looked before COVID, so there was a world before COVID. And the world
I
before
barely remember it.
COVID,
Yeah.
the world before COVID is where you can find lots of the truth. And the world before COVID has HIV, which is a virus. They've tried for 36 years to get a vaccine for HIV.
Mhm.
They have tried for 50 years to get a vaccine for respiratory syncytial virus and have not been successful. And coronavirus, they were trying to get one for SARS and MERS, which were earlier in the 2000s, and they were never able to get one. And so this idea, as much as Trump would like to say so, I think there should be concern about anything that would come out so quickly. I just read last night that, so phase 1 is this sort of initial testing, and phase 2 is looking at these people later to see, and it's usually about 18 months long, phase 2. And then you get to phase 3. Well, they've done phase 1, they started phase 2, but they're not waiting for phase 2 to be done, which is testing for the safety of it. They're just leaping to phase 3.
Okay.
And so, they might get out a vaccine, but whether or not it's going to be safe is the question. And there was a study that I found that came out in 2012, and it was on coronavirus. And so here were these researchers who are trying to find a vaccine for coronavirus It was funded by Fauci's department. It started in 2008. They reported it in 2012. And what they found was they gave the mice this vaccine. And then they killed half the mice, and they found that all those mice had antibodies, which seemed like a really good result, right? But then they exposed the remaining mice to the actual virus, at which point the remaining mice became severely ill. And what they said was it made the virus more virulent in those who were vaccinated. And so their recommendation at the end of the study was that they should not try this on humans. And of course, those were whatever those were, right? They aren't the ones that are being tried today, but it was all about coronavirus. And it made them remember about a study back in 1969, and they talk about it in this 2012 study, about syncytial virus, respiratory syncytial virus, which is infants get it. So they did a human trial with babies. And 2 of the babies died, and 80% of them were hospitalized when they were exposed to the real thing.
Jeez,
They'd all been vaccinated, and it backfired when they got to the real virus.
Well, that's a huge problem. Definitely throws up some roadblocks for vaccines. Another approach I've heard people suggesting is that of herd immunity. What are your thoughts on that? Do you think we can reach herd immunity realistically? Are masks interfering with that? What are your thoughts?
Herd immunity is such an interesting thing that's happening now. Now, if you were to listen to Governor DeSantis's roundtable with these 3 experts on the 24th of September, which was the day before he opened up Florida. So I have transcribed the part about herd immunity and put it on our Facebook page, which is CCH Freedom. So just go to Facebook and put in CCH Freedom or Citizens Council for Health Freedom, and you'll find this, because what the expert actually said was he believed in that we should look at the ages. And because it is such a minimal risk to people who are younger than 50 or younger than 60, he said all of them should go about having a normal life. And amongst that crowd is where herd immunity should happen, because they have so little risk of dying, and not to expose the elderly, to not build up the herd immunity in the elderly. So herd immunity means that enough people get sick and infected or immune so that the virus has nowhere to go anymore. It has no subjects to find, like keeps running into people who are already immune to it. And eventually it just can't replicate and it dies. And so, but his suggestion was to do it within the majority of the American population, which are the people under the age of 60, and let them go about with normal life. And then the elderly can just protect themselves for a while until they reach herd immunity in the young. And then everybody can come out and life can be normal.
That seems pretty straightforward. Build herd immunity with the people that are very unlikely to die while you use the resources that you're going to expend to protect the vulnerable people.
Right.
Unfortunately, we didn't really see that in Minnesota. We did a horrible job protecting our nursing homes. That was a real tragedy. You bring up Governor DeSantis, other states' approaches. What do you recommend for Minnesota? We're still pretty locked down tight at this point.
Well, the lockdown, if you might recall that the first 15 days of this in March, it was just supposed to be 15 days to flatten the curve, to make sure that the hospitals wouldn't be overrun. And now, what are we at? We're going on 7 months here. Now, they aren't even telling us how many people in total are in the hospital every day. And we know that it is nothing near where they ever thought it was going to be. And so it's like there's all this lies and misinformation, and this information they're not telling us in order to keep the fear factor high. So they keep talking about the cases, but it doesn't matter about the cases, right? It really doesn't matter about the cases. And now we find out from the New York Times that of all the cases, they looked at all the positive cases in Nevada, Massachusetts, and New York. And they said because they did the test wrong, that 85 to 90% of the positive cases are probably not positive.
Yeah.
I don't see that they're talking about that here in Minnesota. So how many of the cases here in Minnesota are actually not positive because they're doing it wrong? And if you want to see how somebody has figured out how to do it right, the NFL, it was announced that the NFL is looking at how many cycles is happening in their tests, and anyone who's got their cycles at the low cycles, which means they have a high viral load, they're looking at those people and saying, okay, fine, you're infected. But they're looking at everybody else and saying, if you get a high cycle test, then you're part of what the New York Times said. You aren't infected and you can't infect anybody. Play ball.
Yeah, absolutely. That's something a lot of people don't realize. If you run the cycles enough and you test and retest and retest and retest, you will eventually find something that looks like coronavirus, even though it's not actually deadly. It's like if you've got like a white sand beach, if you dig long enough, you'll find a gray pebble, but that doesn't make it a pebble beach. It's still a white sand beach. Yeah, absolutely. Speaking of misinformation, I feel like there's been a lot of misinformation around hydroxychloroquine. What are your thoughts there now that we've seen some of those restrictions on it ease up in the last couple weeks?
Well, they have eased up, but the controversy has not. I think that people need to look not at where the real bureaucrats are and the big money people who want us to have a vaccine and they don't want us apparently to have a cure, because in the countries that have a malaria problem where they regularly use hydroxychloroquine, they have a very, very low death and infection rates. And then in Brazil, they regularly use it and they attribute hydroxychloroquine to their people, being saved from it. DeSantis himself had a case in Florida where the guy thought he was going to die. His friend sends him information on hydroxychloroquine. The guy is saying goodbye to his friends and his family on his phone when his friend texts this to him. And so he asked his infectious disease doctor, can I use this? And the guy said, okay, fine. This was early before all of it got political, right? And so they gave it to him and he said he woke up at like 4:35 in the morning and he could breathe. His fever was gone. He was like, oh my goodness. And so DeSantis ordered all this hydroxychloroquine for the state of Florida. Mm-hmm. Thailand uses it prophylactically for their healthcare workers. Mm-hmm. So how many people have died because hydroxychloroquine has become a political medicine rather than a real medicine? Right? It is a real medicine, but the politics have gotten in the way. And I think a lot of people have probably died. And a Yale professor says that we could have saved probably tens of thousands of people if we had just given them hydroxychloroquine in the early part of the early stage of the illness. Now, Governor Walz quietly lifted the ban. Mm-hmm. And we have sent a letter into the Board of Pharmacy to figure out exactly what they are doing to help make sure that pharmacies will actually issue the medication, dispense the medication if a doctor orders it. Mm-hmm. And so we've gotten one response back, but it's not sufficient. So we'll be going back for another one.
I think you're referencing something very interesting there. I saw a post from Dr. Scott Jensen, state senator and medical doctor, recently, who said that he would write hydroxychloroquine scripts and they wouldn't be filled by the pharmacy, even though, off-label prescribing is exceedingly common. Is that a report that you've heard as well?
Right. That is a report. That's wrong, because there's actually a law in Minnesota that does not allow the pharmacies to divert from the prescription.
Right. So pharmacies are legally prohibited from doing that, but it seems like they're going ahead and doing it anyway. Well, that's fairly egregious. Another example of the system breaking down. You referenced something that I want to go into more detail about. You said that there might be certain big money figures with an interest in a vaccine and not a cure. Could you expand on that a little bit?
Yeah, so I looked for the original documents. I was watching a documentary and I thought, well, is this true or is this not true, right? About the CDC having a patent on coronavirus transmissible to humans. Mm-hmm. And sure enough, in 2007, I believe is when they got the patent. And they also at that time sent a letter to the patent board asking for it to be anonymous. And so Moderna, for instance, which is one of the leading vaccines out there, they will probably have to share the money that they receive for the vaccine with the government, with the US government. And I am not certain to the degree which the departments themselves and people like Fauci, may have an interest in that or may have stock in Moderna. I have no idea. But what I do know is that the government certainly has that. And I believe there has been $9 million given for the development of the vaccine, but that is not the half of it, because the CDC director said that they have purchased sight unseen before the trials were done, 100 million vials of vaccine for Moderna, 100 million vials of vaccine from Pfizer, One of those is $1.95 billion contract, and the other is like 1.25, or maybe it's 1.55, you know, whatever. But it's almost $3 billion so far that the government has agreed to sight unseen for these vaccines. And so if you have any, you know, if you got stock in one of these, right?
Yeah, I know people
Or if
that
you
did
work
that.
for
They bought a bunch of stock in these companies and made a ton of money very quickly.
Yeah.
Wow. That's really disturbing. It seems like you've done a lot of sort of heavy lifting and hard research into this kind of stuff, but the average person simply doesn't have the time, the energy, or the resource to get that involved in this. How can people go about getting this information for themselves? What sources would you say are reliable?
So I'm just going to give my own plug in
Yeah,
that we have a series of Facebook live videos, COVID-19 updates. And so give actual documents. You can see the actual documents where we have found the research. We will leave the links to those documents. People have said it makes it very understandable. And so everything from masks to vaccines to the actual pathophysiology, which is a really big mystery. So people who have COVID and they have it is severe, and it still is a mystery to doctors exactly what's happening there. So explaining all sorts of those things. And so on the Facebook at CCH Freedom, or just put in Citizens Council for Health Freedom, or just go to our webpage and then click on Facebook, right? And then you'll get to our videos, our COVID-19 videos. You can also find them at patienttoolbox.org. Patienttoolbox.org. We have a coronavirus drawer in our toolbox. And one of the choices after you get to the drawer is the videos. And that's all that is COVID-19 videos. I will be doing another one today talking about the RNA vaccine and what it means to have an RNA vaccine, and some of what people are saying are the concerns and the benefits. And then I would suggest as well, if people wanted to watch a video, watch the video of the roundtable that DeSantis held. DeSantis is amazingly well-versed in all the information that I share, or a lot of the information that I share in our videos, our organization's videos. But you'll hear from 3 experts who really, I think, will change your mind about being afraid and about, you know, what the truth is about what's happening here with COVID-19. You know, from our perspective, this is really a frontal assault on freedom in America. It's not just about COVID-19 anymore. COVID-19 is very small, relatively speaking. It is the assault on our freedoms and our privacy and our way of life. I talked to somebody who couldn't believe that people would just stay at home because the government said, and you know, in countries that actually require you to do that, they don't look anything like America's supposed to look, right? And people just submitted. And so, yeah, the other thing is Twitter, and ethical skeptic has some very interesting diagrams now on the deaths that are being caused not from COVID itself, but from all of the reactions related to COVID. And I would encourage people to look at that. And he has got something called legacy death laundering that's happening now. So that deaths that happened maybe even as long as 2 months ago are now registering as deaths now, inflating the death statistics now. But they clearly aren't inflated enough, because still government is talking about cases as though that is what's supposed to make you afraid. And cases should not be making you afraid. That should be expected. That's the way to herd immunity. Lots of the cases aren't even cases. And there are studies now that say we don't need everybody. We don't even need 60 or 80% of the people infected to get herd immunity. They are thinking it's only 17 to 20%. Because as just one example, the Princess Diamond cruise line, Diamond Princess, the Diamond Princess was stuck with all those people with coronavirus, and they were stuck there. And at the end of the day, only 17% of the people ever got sick, all stuck together on a cruise.
Yeah, so I remember that. I feel like that story has kind of disappeared from public consciousness, but that's a very important fact to bring up. Absolutely. I think all those resources you suggest are fantastic. I just took a quick look at Ethical Skeptic and some of those graphs. Those are fantastic. Of course, your organization is fantastic. We want to go now to a couple of viewer questions. We always love answering questions from the viewers and the listeners. First one comes from Doug Daggett. Hope I'm pronouncing your last name properly, sir. He asks, what is your understanding of how many COVID-19 deaths resulted from the Sturgis rally? My limited understanding was that only one death occurred, yet the media predicted that this guy would fall down. What are your thoughts on Sturgis?
So actually I haven't, because we just had our event, and it sort of took us a little bit away from doing the kind of research that I would like to do.
Yeah.
So I don't know the actual number of deaths from Sturgis. And then again, just always remember, is it a from COVID or is it a with COVID death? Mm-hmm. This is so critically important, because as Senator Scott Jensen has said, the CDC told everybody who was doing death certificates, if they just think it's a COVID death, even if they don't know, that they were supposed to put COVID in there. And the head of Illinois' health department said, if we know you're terminal, you're in hospice, we know you're going to die in 2 weeks, and then we discover you have COVID, it's a COVID death.
Yeah.
Right?
Yeah.
So even the Sturgis, who are the people who went to Sturgis? What did they die from? They're COVID deaths when they died because they were in a car crash, and it's still considered a COVID death.
Yeah, I mean, that's something that we've sort of been aware of for a very long time. But every time I hear it reiterated, it's shocking that somebody can die of, pancreatic cancer they've had for 3 years, but they happen to have coronavirus, and suddenly it's a COVID death. Our last viewer question also comes from Doug. He says, I may have missed this, but what % of COVID-19 tests in Minnesota are coming back negative? Good question.
That is not actually reported, I don't think. The percent, well, there is a % of how many tests that they have done, but I think the question a little bit about that as well is what Ethical Skeptic points out, is that in the number of tests done, they often don't talk about the duplicated tests. They don't talk about the time you go in and you find out a second time that you're still positive. It's as though there were 2 people being tested rather than 1. And so I do not have a good answer for that one, but I think those are some of the things to consider about the testing results.
Yeah, I'm also kind of looking into this just very quickly, and it looks like I can confirm what you're saying there. I haven't looked into it a ton, but those negative tests are not reported. You bring up a very important point, though, about the double positives or people being registered twice.
Right.
Okay, so we've covered a lot of ground today. So we're sort of coming down to the end of our time. For those of you who weren't here for the first half of the show, we talked about health concerns and how your children's DNA might not be as private as you think. Then we moved to speak about coronavirus. I suppose in summation, could you just give us your thoughts on what people need to do moving forward? We're facing a lot of these different problems with privacy, with coronavirus. What can people do to help fight the good fight? And where can they buy your book? Because I would love to read it.
They can go to bigbrotherintheexamroom.org. It is temporarily not available, although we have a few copies in our office that might be available. So we are going to be doing a reprint. So it's sold out twice. And okay, so that was the book. And then what should people do? People should stay informed and engage. They can certainly hear about some of these things if they sign up on our website at cchfreedom.org, just at the very top of the page. They really need to contact their members of the legislature and say, what are you going to do to shut down Governor Walz? This is no longer an emergency. This is just a usurpation of all the rights of Minnesotans. And they need to put more pressure. They need to put more pressure, and then they need to change the law so this can never, ever happen again, ever.
Absolutely. People oftentimes underestimate the power of state and local government, but they should not. Those state senators have a lot of power, and we've seen the governors around the nation flex their power over the last couple of months, almost a year. And, we can't underestimate the power the state legislators have either. Thank you so much for joining us today. It's been a fantastic conversation. Again, if you just tuned in for the second part of this conversation, you need to go back in the Alpha News live stream archive, watch the first part. Really shocking stuff, really fascinating stuff. We'll be back at 6:30 tonight with Jake Duesenberg from Action for Liberty, and we really appreciate you joining us right now.
Thank you so much.